alive, and my dad's 85 and my mom's 82. Whereas my dad is so both. He's going both ways. He knows he wants to die. In fact, their names are on a cemetery headstone as we speak. And when Becky said you were able to share some things with your mom and have that discussion, my dad wants to play pinochle instead of have the discussion. And I'd really like to be helpful without pushy. And I just don't know. Whereas my mom, she's very open, but boy, my dad's so conflicted at this point. And I just hurt for him because I'd love to see him have the easy death. Because he wants to go, he's not well, and at this point he's just sort of miserable, and he's in a limbo.
I guess I know that's very difficult. A lot of people struggle with that, parents particularly. And I guess there's little suggestions I can make. I don't know if it'll help, but for one thing, does he have an advance directive for healthcare as 5 wishes? Okay, because sometimes that helps. It's sort of a practical kind of thing. Where
we made him do it. He did it kicking and screaming all the way.
Okay, well. And also at his age, there must be other people who's probably about his age who are dying, whether in the news or friends or someone. And so certainly talking about that every time someone does die, and maybe even would you want to die like this person did? If not, is there anything we could do to help them? What would you want? So forth, so kind of start the discussion.
Judy, I most humbly disagree. If he doesn't want to talk about it, don't talk about it. Do what you want to honor him and let it be. If he wants to play pinochle, let him play pinochle. He's not, don't push somebody into a place they don't want to be. You give people the information and let it be and let them come to that place for themselves. And you learn the lessons of what you want and how you want to handle it when it's your time. Okay? I'm sorry.
I like it. It's a lively discussion.
It's okay to disagree. And I agree that you really don't want to break through somebody's denial. But I guess sort of encourage a little bit, maybe, if it looks like there's a moment that might really make it more open.
Yeah, we've seen a lot of cases that go both ways. Some people who seem like good, something triggers a change, but it's also my father certainly was much more that way, but it was taken care of in the last period, and I think there's a lot of what Boris says about, just there's different folks, and some are not going to do it the way we have come to understand it. It would make more sense.
Some of our great spiritual practitioners have sort of been in denial and they're dying as well. So it's a difficult thing to do, to truly accept that you're dying. So you have to recognize that.
Is there such a thing as an advance directive for death care?
Yes, that's what it is.
Yeah.
What do you mean?
So,
Death.
well,
After.
the after death.
Yes.
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 Let me tell you, in California, this is not the case in all states, but in California, our advance directive for healthcare does mostly talk about if you're not able to make your own healthcare decisions, then the people you name can make them for you and so forth. But also legally, those same people can make decisions after your death. So they're legally authorized to sign cremation permits and make all the funeral arrangements and so forth. So it is a health and death care advance directive.
I, in the last year, experienced both death with a good friend in a hospital and death with a friend in her home. And what I noticed was that in the hospital, the group of us present felt very much like we had to go along with what the hospital routine was. And the reason I asked about advanced death care directive is that, is there anything that helps, like in your situation, Boris, for you to have been able to have said, and now I'm going to take my husband home?
Yes. I did not know I had the right to do it at the time. And unfortunately, I had the same experience with my mother 5 years later. And so with those experiences, I know I have rights to help them do what they feel is most appropriate for them, even though they may not articulate it. But that's the reason why I've gotten involved with 5 Wishes, because I think it's important for all of us, those of us who are well or who are able to identify how we want to be treated and share that information. And the fear that we have of death, touching the body, caressing the body, washing the body, taking care of the body, that's what we've got to get rid of and know that this is part of life.
Yeah, I might mention, my mother died in ICU at St. Helena, and at that point, it was during the last several hours that she was there, she was in a coma, so she really wasn't making her own healthcare decisions. But it was, boy, it was difficult, because it felt to me like I finally really got the picture that all this sort of dance of the medical people around her was such that one system would fail in her body and they'd prop that up, and something else would fail and they'd prop that up, and something else would fail and they'd prop that up. And now you have to see, she's going to fail. I mean, her body just wants to die, just allow her to do it. And I felt like there was this speeding train of the medical profession just speeding, and I almost had like jumping on the tracks in front of the train and yell, stop! It was, I had to be that forceful. So no more of this, no more of that, no more of that. And I didn't take her home, kept her there, but it's still 20 minutes after I just said no to all these things, she just died. But it's very difficult, even just making those decisions.
And so if it can possibly be not in that circumstance where the medical thing is, it is a train that runs, and, so in that circumstance it's hard.
Given your sensitivity and experience, what were you able to do once she had died in the hospital?
Well, one thing is our spiritual teacher actually says, even though we do these 3 days, he actually says at the very beginning portion of that, maybe the first couple of hours, is the most significant, because that's the time that the person who's dying is kind of experiencing the most confusion and chaos. And so it's the time you really want to keep them most undisturbed and relaxed and giving them instruction and so forth.